Look at you. Hey, Autumn, how are you?
I am so well. It's good to see you, Holly.
Oh my gosh, absolutely. So I wanted to just kind of hop on. I know that you've probably seen some things that have came across recently. We've been talking about all of the new changes that have been ongoing. So this last week, we actually had a webinar that was specific to the new Biden COVID mandates. So we brought on, I think we had Dr. Cherry, we brought on Chuck Cable, we had Dara, quite a few. And so they answered some great questions that were specific to who does it apply to? How is it that we're going to manage this? How do we even start to think about sourcing supply? Should we consider it being, mandatory for all of our employees to have these vaccines, or should we also go the route where it's testing? So there's just a tremendous number of questions that had kind of came through there. And so I think we had almost close to 1,000, maybe. I think it was close to 1,000 that had actually joined. Yeah, lots of questions. So we're actually going to kind of gather again this week and go through some of those and get some additional answers. So what have you been seeing on the communications front there?
Well, we've had an influx of questions coming in from the press as well. Everyone's really concerned and confused about this emergency temporary standard that states that all employers with 100 or more employees have to ensure that their workforce is fully vaccinated or require any workers who remain unvaccinated to produce a negative test result weekly before coming to work. That's putting a big strain on our supply chains, on our employers, on our employees. It's very tricky, and we all want to stay compliant. We all want to stay safe, but we need to honor all of the rules and regulations around this. So there's a ton of questions that's been flooding in. No one has a crystal ball to really determine what exactly is going to roll out. But the most important thing is that we get in front of this issue, that we're not just waiting on our laurels to hear what's next. I think it's really important right now for organizations to think about an infectious control policy, think about how they're going to do this on an operational level, and how they're going to treat people who maybe have medical conditions or religious beliefs that might offset some of these mandates. So it's a really hot topic. We're all trying to figure it out. And it's so important that we come together as a group and really discuss all the ins and outs and the details of what could this mean.
Oh, for sure. Yeah. And that's the other thing I was going to ask you. Didn't you have some interviews this week with the press that was related to some of the questions, fielding some questions there?
Absolutely. So we had a few reporters reach out to Dr. Cherry and Chuck Cable about some of the laws around this. What do we need to do to protect our workforce? That's rule number one. Whether these standards go through tomorrow or they go through and are enforced 3 months from now. The most important thing is that people are getting sick now, and we need to understand how to work through that, how to make sure that they're getting the resources and tools that they need to stay healthy and to keep their coworkers safe. And if people are at home, maybe keep them at home. That's the safest place for all of us, right?
Really good point. Yeah. And you're seeing a lot moving in that direction as well, that they are considering that, making this more of a permanent arrangement where you're doing the work from home versus having to come into the office.
Absolutely. And we've seen an influx in COVID cases too, with kids going back to school. So even if you are working at home, you still have the little ones coming home with, maybe they have a mask policy, maybe they don't. There's just so much ambiguity around this. And when we see these spikes with Delta and there's other variants on their way, we just all need to keep safe and, just really work together and make sure that we're all looking out for each other and trying to stay safe emotionally, mental health wise, exhaustion wise. I mean, self-care is really important as we're working through all these details of how to move forward as a business.
Absolutely. Well, Autumn, I am so tickled that you joined us today. Actually, I was just going to kind of mention that the webinar that we did this last week, we had so many questions that came in from that. So we've rounded up the horses. We're going to bring them in one more time today. It's kind of rapid fire questions there called Speak Up, a town hall. And so what we'll do is take the questions that we had from last week, along with some that have been sent to us throughout the week. And obviously, while we're in the event, we can field some questions there as well. But they're really going to focus on OSHA mandates, who these mandates may apply to, how is it that you need to, consider both the vaccines and testing, what makes that, what would be a good option for you as an employer based on what your employee population is, obviously some policy development, and then on the backside of that, we'll go through some of the support mechanisms and how it is that you may want to look for some support in these areas. It's not a one-man show here, and this is a lot. It's a heavy load. So there's a lot of provisions that need to be made, and I would say that that's really kind of one of the things that's driven not only our team, but also our organization throughout this entire pandemic was that nobody has answers. Nobody knows what to do. And so to be able to take something that's so large and bring it back down into bite-sized information that you can kind of spell it out in black and white that, hey, this is what it is. This is how we can fix it. This is what you need to be monitoring going forward. It makes a big difference, and it definitely kind of gives you that opportunity to kind of take a deep breath and say, okay, I'm not in this all by myself. I'm not the only one that's dealing with this. So if you guys have not already registered, again, that's going to be at 1 o'clock today. So you've got a few minutes. Looks like you got, well, maybe a little less than 20 minutes. So what you would do is you would select that link that's right there. I believe that Jason added the link there. That'll bring you to this page. You just put in your information and it will send you a registration code. And I can't wait to see you there at 1 o'clock. So I hope that if you haven't already, please make sure you get registered and I'll save you a seat. Thanks, Autumn.
Sounds good, Holly. Take care. Of a great webinar.